I've always been active. I've always been a do-your-own lawn work, play golf, go fishing. What I first noticed that I had a problem was a skin rash. The rash was very itchy and I couldn't sleep at night. My VA doctor took one look at me and said that I was jaundiced, my eyeballs were yellow, and that I probably had a liver problem.
Buzz was shocked when the symptoms he thought were a small problem turned out to be cancer of the bile duct, a highly lethal form of cancer.
Bile duct cancer, or cholangiocarcinoma, which is its medical name, is a rare cancer. There are only about 3,000 cases a year in the United States. It's a cancer that originates in the bile ducts, or kind of the plumbing system of the liver, and can be difficult to diagnose because it occurs in a part of the body that's hard to image. The 5-year survival is probably on the order of somewhere under 20%.
Because of the location of the bile duct, it can be difficult to safely remove the disease surgically, even if it has not spread. But a new protocol being utilized at the University of Michigan is bringing hope to some patients: liver transplantation for bile duct cancer.
Historically, transplant has not been thought to be a great treatment for cancer. And the reason for that is if you transplant someone at a point when the cancer is more advanced, the anti-rejection drugs, which suppress the immune system after transplant, are kind of like gasoline to a cancer. So any microscopic cells anywhere in the body related to that cancer will kind of grow like wildfire after transplant. What we've learned in recent years is that if you select patients very carefully and find the patients who have locally advanced disease that's not resectable, but disease that is not spread elsewhere, those patients can potentially be helped by transplant.
Patients undergo a rigorous screening process, utilizing advanced imaging and tissue biopsies to make sure the disease has not spread outside the area of the local tumor.
They had to qualify me for the transplant through checking lymph nodes to be sure the cancer had not spread, checking my lung tissue, my kidney tissue. I went through many, many MRIs and CAT scans looking for bad things that may happen to me if this transplant was done.
Patients are then treated with chemotherapy and radiation to destroy any errant cancer cells, retested to make sure the cancer has not spread, and then listed for transplant.
The phone call came after being on the transplant list, I guess a month to 6 weeks. I had the liver transplant April 25th of 2010.
What we obviously are waiting to learn is what is going to happen to these patients long term. The 3 to 5 year survival looks like it's going to be in kind of the 70 to 80% range. Is far better than any other treatment we have for bile duct cancer. For the number of patients with bile duct cancer, this is their hope, this is their way out.
As far as we know, I'm cancer-free. I've had some other procedures that have slowed me down a little bit, but we're looking forward to this being my first full year of retirement. Had I not had it done, I wouldn't be here. So, the physicians at U of M basically saved my life.